Okay, let's be real. Finding some weird new rash on your skin is, well, it's pretty unsettling, right? Is it serious? Today, we're going to clear up the confusion between two common culprits, the rashes you get from Lyme disease and Bartonella.
You know that moment, you're just going about your day, maybe getting out of the shower, and you spot it. A mark that you know wasn't there yesterday. And your mind just starts racing. What is that? Where did it come from? Is this a big deal?
Look, that mark could be absolutely nothing, but it could also be your body's way of sending up a flare, signaling a deeper issue. So let's get really clear on two key possibilities, and most importantly, how to tell them apart. So here's what we're going to cover. First, we'll talk about where these rashes even come from. Then, we'll get into the nitty-gritty of what they actually look like. After that, we'll explore symptoms that go beyond the skin, talk about how urgent treatment really is, and finally, we'll wrap it all up with the single most important takeaway you need to remember. All right, let's dive right in. Section 1, a tale of two rashes. So what's the actual story behind these mystery marks? Okay, this is probably the most important thing to get straight right from the start. We are not talking about two versions of the same problem here. These are totally different infections. Lyme disease, as we all know, is famously transmitted by ticks. Bartonella, on the other hand, often called cat scratch disease, spreads differently. And because the infections are different, the rashes they cause look completely different too. Okay, so if the infections are so different, what does that actually look like on your skin? This is the part we all want to know, right? Let's get visual and break down how you can spot the difference. Believe it or not, the visual difference is super clear-cut. If you only remember one thing from this whole explainer, make it this. Lyme rashes, they're typically round and they spread out, kind of like a bullseye. Bartonella rashes, totally different. They're streaky, almost like scratches or stretch marks. All right, let's zoom in on the Lyme rash. The fancy medical name is erythema migrans. It usually pops up anywhere from 3 to 30 days after a tick bite, and it just keeps expanding outward. It might feel a little warm to the touch, but here's the really tricky part. It's usually not painful or itchy. And that's dangerous, right? Because if it doesn't bother you, you might just ignore it. Now, let's flip over to Bartonella. These streaks are called Bartonella striae, and they can be red, sometimes even purplish. And here is a dead giveaway. Unlike a normal stretch mark, these streaks don't follow the natural lines of your skin. They kind of go wherever they want. You'll often spot them on your trunk, arms, or legs. Okay, so we've got the visual clues down, but these rashes, they're not just a skin thing. Think of them as a tip of the iceberg. They're the outward sign of an infection that's happening inside your body. That's why it's so important to look for other symptoms too. With Lyme disease, if you don't treat it, it's known for getting worse in very clear stages. At first, you might just feel like you've got a bad flu. Fever, you're tired, achy. But give it a few weeks or months, and things can get way more serious. We're talking severe headaches, really painful joints, even facial paralysis. And if it's left for years, well, that can lead to chronic arthritis and some pretty serious neurological problems. But then you look at Bartonella and it's a completely different story. It just doesn't follow that same neat, predictable timeline that we see with Lyme. Its progression is a lot more chaotic, which honestly can make getting a diagnosis a real puzzle. So if there aren't any clear stages, what are the red flags? Well, along with those streaky rashes, you're looking for things like constant fatigue, headaches that just won't quit, bone pain, swollen lymph nodes, and sometimes some other weird neurological changes. You can see how there's a lot of overlap with Lyme, right? Which is why spotting that unique rash is such a massive clue. All right, hearing about all these potential symptoms, it naturally brings up a really important question. Just how urgent is treatment? Is there some kind of ticking clock, a window of time you have to act in? Let's put it another way. Once you see one of these rashes, how long do you actually have to get treated before the infection starts causing bigger, maybe even permanent problems? Well, for Bartonella, the answer is a bit nuanced. It's not like there's a strict 72-hour deadline or anything. But, and this is a big but, the advice is crystal clear. Get yourself evaluated by a doctor as soon as you even suspect it might be Bartonella. The whole goal is to stop that infection from spreading and causing more trouble. So let's just boil this all down into 3 simple, actionable steps. Number 1, see the rash for what it is. It's a signal. It's your body telling you something's up. Number 2, get a prompt medical evaluation. Don't wait. And number 3, remember this universal rule for both of these infections. The sooner you start treatment, the better your outcome is going to be. It's that simple.
Okay, it's time to put all the pieces together. If you're going to walk away from this with one core message, this is it.
Let's do a final side-by-side. The rash, for Lyme, think bullseye, round, and expanding. For Bartonella, think streaks that look like scratches. The symptoms. Lyme tends to progress in those clear stages we talked about, while Bartonella's timeline is way less defined. And finally, urgency. With Lyme, it is absolutely critical to treat it early. With Bartonella, getting a prompt evaluation is highly recommended to prevent bigger problems down the road.
So I want to leave you with one final thought. These rashes, they're pretty clear signals, but let's be honest, they're also really easy to second guess or just blow off. So the question is, when it's your health on the line, what's the real risk of guessing wrong? The message here couldn't be clearer. Don't guess. Go get it checked out.